So, what are some common disease conditions or medical conditions of bone? Let's take first osteoporosis. What do you understand by osteoporosis? Osteoporosis is one of the bone diseases that can lead to an increased risk of what? Fracture. And it's called BMD. BMD means bone mass density or bone mineral density. Can you see that? It's called BMD. When there is a low BMD, which is bone mineral density, then it's called osteoporosis. It means there is what? A disruption of the bone architecture or the microarchitecture. And in women, the most common cause is what? Menopause. Do you know menopause? It's called postmenopausal osteoporosis because estrogen is very important for bone, okay? While you are young, like young adults, okay, or young. But when there is no estrogen, what will happen? The bones will become loose. Okay, they will become thin. That leads to osteoporosis. That's the most important cause of osteoporosis in women. Okay, and usually it leads to fracture, especially there is fracture of here, fracture of which is called Colles fracture. The distal radius is fracture, or here femoral neck can usually be fractured. So that's because of postmenopausal. So what do you do if a woman comes with that? She has, oh, I have bone pain, and what shall I do? So you give what we call bisphosphonates. Okay, sometimes also some other medical treatments can help. The other condition is what we call osteogenesis imperfecta, or it's also called OI. OI. The other name for this is brittle bone disease. Brittle bone. I remember we used to see this brittle bone disease. And I remember one time a patient came and then she has fracture in many areas. She's fractured bone here, she's fractured here, and you fix that one and the other one will break, the other one will break. She had really very problematic. So it's called brittle bone. That means the bones can easily break, boom, they will just break. It's like a congenital inherited from birth. She had it from birth, okay? So there are 4 kinds of this one, actually 4 types. Type 1, type 2, type 3, and type 4. Okay? What's the cause of this? Usually because they have defective connective tissue. Okay, so they have also weak bones. And other symptoms they have is that they have blue eyes. You know, it's typical for that. They have like a blue tint to whites of the eyes. Okay, like bluish eyes. Have you ever seen that? It's called blue sclera of osteogenesis imperfecta. Can you see here? Can you see?
Yes.
The sclera will become like blue on the white. On the sclera, it's called sclera. Now our sclera is what? White, yes? Okay? But when we have osteogenesis, they are born with a blue sclera. It's blue. Yeah, that's typical. If you see a baby born of this, that's typical. That's osteogenesis imperfecta. A baby born of a blue sclera. Huh? A baby born of a blue sclera. Okay. So they have also what? Hearing loss. They have bowed arms because the bones are what? Brittle. So that's why they have a bent arm and legs. Yes. And they have kyphosis. Kyphosis means what? On the back, they have a bent curvature of the vertebra. And they have also scoliosis. Okay, what is kyphosis? Kyphosis is a backward bend. Scoliosis is a lateral bend on the side. If this one is bent on the side like this, it's called scoliosis. If it's bent on the back, that is what? Kyphosis. If it's bent forward, it's lordosis. kyphosis, scoliosis, lordosis. So what can you do for diagnosis? You can't do skin biopsy. You take like small surgery, you take biopsy from the tissues and you test for the defective tissue. Is there any cure for osteogenesis? In man's eye, there is no cure.
Do people die from this?
Huh?
Do people die from it?
I mean, every time the bones are broken and yeah, you see, they don't die like very early. They live, their birth is like very cumbersome, like every time bones break. This one breaks today, the other time, then another bone will break, you fix that one. Every time bones are broken. And the bones can't heal well because they don't have that because there's a defective bone synthesis and defective collagen. So which medications can you give? Just like bisphosphonates. Okay, then bone fractures. What do you understand by a fracture?
When you fall and break?
Huh?
When you like fall.
Yeah, the definition is a break in the continuity of the bone. That's the definition. A break in the if there is a break in, let's say this is a continuous thing, yes? If it breaks here, then the continuity disappears. That means there is it's no more continuous. It's continued. That is called fracture in bones. It can result from what? From a force, like when something is okay, or injury, like car accidents and so on. They can lead to. Okay, so we have we can have two kinds of fractures: closed and open. Closed means if no wound and the bones are broken inside, that's called closed. But sometimes there is an open wound from outside, that's open. Okay. And that open, it can be from inside or from outside. Okay, again. It's called from within, from without. From within means if the bone, it breaks the skin, that's called from within. But if it is from outside, injury is called from without. That's very important to know. Why? Because if it is from within, the wound is relatively clean because the bone is the one that punctured it. Yes? But if it's from outside, it's more contaminated. So what are some symptoms of bone fracture? There is swelling, bruise, pain, deformation, inability to use that limb. Nowadays, imaging technologies like CT scan, MRI, you can use for that. Treatment can be conservative or surgical. Conservative means you don't use surgery, just you can treat with casts or with traction, with splints, with slings, with all this. That's called conservative. Can you see sling or sling? Then what do you mean by dislocation? Dislocation is when the joint is outside of its surface, it's called dislocation. Let's say when this shoulder joint is outside of this, it's called dislocation. So it can be partial or total, if only part of it coming out or the whole of it is coming out. For example, hip joint, it can be dislocated anteriorly, posteriorly, or central. Also the shoulder, it can dislocate anterior or posterior, like the front or the back. Important, how can you diagnose? One, there is deformity on the joint, there is swelling, and X-ray. The sprain is when it's caused by overstretching of the joints. When the joint is more than its capacity, then it's called, because there are ligaments, those ligaments will be stretched and then they break. Okay, and that area may bruise, it might swell, or the ability to move will decrease. So X-rays can also be done to ensure there are no fractures. Treatment depends on the level of injury and the joint affected. Medications such as NSAIDs, like non-steroidal anti-inflammatory drugs, can be used, like aspirin, ibuprofen, indocin, and also what we call ice, put ice, compression, rest, and elevation. Arthritis is another condition of the joint where there is inflammation of the joints. It can be caused by diseases because of degeneration of the joints. For example, conditions can be osteoarthritis, rheumatoid arthritis, psoriatic arthritis, septic arthritis. Septic is because infection. When there is infection and the joint infected, it's called septic arthritis. But if no infection, it can be rheumatoid, it can be osteoarthritis, it can be psoriatic. What does an arthritis have? They can have pain, joint stiffness, swelling, muscle ache, weight loss, inability to use the hand or foot. Most important diagnosis will be blood tests and radiology. Especially blood test is important for rheumatoid arthritis. There is what we call a rheumatoid factor that can be positive. Or there is what we call anti-nuclear antibodies, which is called NA, that can be positive. SR, the erythrocyte sedimentation rate, is usually high or increasing. So what can you do in this case? Usually mild exercise, physical therapy is important. Medications, anti-inflammatory like acetaminophen, ibuprofen, and then some heat to the joints is also important. Neuropathic joint, that is also a joint condition that is caused because of a progressive degeneration of weight-bearing joint and loss of function and reflexes. It's caused by some disease called tabes dorsalis. Tabes dorsalis is because of syphilis, leprosy, syringomyelia. Okay, what does the patient has? Swelling, excessive mobility, and or bone destruction. How do you treat? Immobilize. Immobilize means you prevent it from moving. Okay. Immobilize with what? Cast. Okay. Pneumatic walking braces or surgical connection of the joint can also be done. Okay.